Our first speaker is Dr. Karyl Rattay. She is the director of the nationally accredited Delaware Division of Public Health within the Delaware Department of Health and Social Services. As Delaware's state health officer, Dr. Rattay leads nearly 1,000 employees who promote health, reduce health inequities, and protect Delawareans from disease, environmental hazards, and public health emergencies. Dr. Rattay is board certified in pediatrics and has practiced pediatrics for 14 years. Between September 2001 and June 2004, she served as a senior public health advisor to the U.S. Surgeon General and Assistant Secretary of Health in the Office of Disease Prevention and Health Promotion, the Department of Health and Human Services, where she had a leadership role in the President's Healthier U.S. Initiative. Dr. Rattay earned a medical doctorate from the Medical University of Ohio in 1992 and a Master of Science in Epidemiology from the University of Maryland in 2001. She completed her pediatric residency at Georgetown University and a preventative medicine and public health residency training program at the University of Maryland. Dr. Rattay, the floor is yours.
Thank you so much, Kate. Thank you for your partnership of the Delaware Academy of Medicine and the Medical Society of Delaware. Even though it's virtual, we are super glad to get to partner on this annual Communicable Disease Summit this year. So for everyone who's joining, thank you so much for taking the time to participate. I am really happy to be with you all today. I'm going to share just a brief update of where we are with COVID right now at this minute. Dr. Hong is going to go into a lot more detail about our pandemic journey. But I also am going to spend a little bit of time talking about just some of the interesting infectious diseases experiences we've had this year. And we've had some really interesting, somewhat stressful, extremely stressful situations related to infectious diseases. So it's not all pandemic. But I think you'll find this interesting as you hear some of our stories. So I'm going to share my screen. So hold tight for one moment while I make this work. Sorry, one moment. It seems like it has changed how this works. And I don't think you all want to see everything here. Do you see my?
Dr. Rattay, if you go to slideshow, so if you go to the.
Oh, thank you. Thank you so much, Kate. Okay, so let me just talk a little bit about COVID and where we are with COVID. You know, we all saw March, April, May of 2020, where we had our first surge and locked down the state and the nation. We had a little bit of bump that summer related to some beach outbreaks. And then, of course, last late fall and winter, we saw a big surge, which we really saw a lot of increases right after Halloween last year. And from our contact tracing data and our case investigations, we saw a lot of people who had gone to indoor Halloween parties, and it really just seemed to spark or catalyze a lot of spread, which then went into many indoor gatherings following that, and a lot of cases, and sadly, a lot of deaths in our state. We hit our lows in July. We were so happy. We thought maybe a lot of this was behind us. And then Delta came around. We saw a fall surge, and much of this among the 5 to 17 population, which I'll talk a little bit more about. But recently, again, we're way back up to some of our highest case numbers. And again, our contact tracing and case investigations showed us, again, lots of people went to indoor Halloween parties and other indoor gatherings, which is really driving these surges that we're seeing right now. We're also seeing high hospitalization rates again, unfortunately. It's not where it was at the peak last winter when it was 474 at our highest, but we've had multiple days last week where we were around 318, 320, and we know that our hospitals are extremely stretched thin right now, especially given workforce challenges on top of everything else. So this is an incredibly challenging time for our healthcare system. I'll talk a little bit about influenza later in the presentation, but you know, that's an added concern right now as we're starting to see increased cases of influenza. And we are seeing geographic differences. So I've been using criteria to define areas of concern all along. There have been times I've adjusted it, but using the criteria that I've been using most of the pandemic, almost our entire state lit up this last week. Our cases are that high. So I used another lens looking at zip codes with a higher than 10% test positivity. And that those zip codes really correlated very closely with zip codes with low vaccination rates. And what we're finding is areas with low vaccination rates are also area with low testing rates. So you tend to test more people who are symptomatic and sick, as opposed to people who are just participating for screening and infection control perspectives. As I mentioned, we've really seen a significant increase in cases among our 5 to 17 population, who's had the highest case rates this entire fall. Prior to that, it was really the young adult population. When you break it down, our 5 to 11 population had the highest case rates, but that was closely followed by the 12 to 17-year-old population. I'll talk about vaccination rates for our pediatric population in a minute, but you know, certainly that's key factor here. So when we look at our cases, hospitalizations, and deaths, these numbers have been pretty consistent since we started really drilling into these data, where largely this is a surge, this Delta surge is a surge of the unvaccinated. You know, most of our deaths and most of our hospitalizations and most of our cases are unvaccinated. And in fact, you know, a good news story is if you look at our death trajectory, we have much lower death rates now than we did at this time last year. But we still are having an impact on our hospital system for sure. And, you know, concern because there are still many unvaccinated people that, you know, our healthcare system may not be able to easily handle what's ahead of us in the coming months. So with vaccination, I'm extremely concerned about how we're doing with pediatric vaccination. Still many months into having access, our 12 to 17 population is just 59.4% having one dose. And these data were from last night. I pulled off of My Healthy Community. In fact, all these slides I pulled last night off of My Healthy Community. And we have in this population, it's only about a little short of 52% that's fully vaccinated. So a large proportion of our adolescent population is still vulnerable, and still over a month into it, we're only about 18.3% of our 5 to 11 population that's received one dose. So very concerned that uptake is very low. But while many people are asking for masks to be eliminated in the school setting, this is a largely vulnerable population at this point. The other thing I wanted to point out is boosters. We know that immunity wanes over time. We really, especially before Omicron gets here, we want to get our population boosted as quickly as we can. Our senior numbers are finally climbing up a little, but we're still only 55.5% of our seniors receiving boosters, and our younger population's much less. So that's another area where we're really pushing right now. So let me shift gears just to talk about general pediatric vaccination trends. At the time of the lockdown and shortly thereafter, big nosedive in pediatric vaccinations. For every pediatric vaccine, we saw a very steep decline. But then we really recovered fairly nicely. So we always have ups and downs depending on the time of year and when kids are getting more well child visits. But for the most part, most all of our pediatric vaccines follow this trend. So we've made a decent recovery. Still, it's really important for our child serving health providers to make sure that they're using every opportunity, every sick visit, every well visit to check those immunizations and get caught up if a child has fallen behind. I'm going to shift gears again. I want to talk about HIV services, which across the board, really, we did see decreases. So after the lockdown, we really saw big decreases in testing. We were at about 2,000 that first quarter, 2,000 individuals who received rapid HIV testing first quarter of 2020. Of course, not surprisingly, that took a significant decrease the following 2 quarters. But we really haven't rebounded significantly. In fact, we're still at about 50% of our HIV testing rates that we were prior to the pandemic. So we are very concerned that we are missing individuals out there who are positive for HIV. That being said, once they are identified, we've been able to keep up quite nicely with getting people linked to care. We also, although we did see some decrease in number of syringes exchanged around the time of the pandemic, overall, we are seeing an increase. And that's really, I want to attribute the great syringe services that we have in the state of Delaware to our partner, Brandywine Counseling, who manages 31 sites statewide and is really doing a tremendous job with harm reduction services and getting people connected to care. So that's positive. It's also positive that we are getting more people referred to a PrEP provider, which is obviously very important. I think a lot more providers are hearing about it. DPH and Gilead are doing weekly PrEP trainings. HIV Consortium just held a statewide summit. Over 70 individuals attended. You may have seen U.S. Preventive Services Task Force just came up with a new recommendation for screenings for all adolescents, young adults for sexual activity. So I'm happy to see a lot more attention is on PrEP, and hopefully we're going to continue to see these numbers increase. But overall, when you look at our HIV numbers, this is actually the first time since 1986 when we had less than 90 cases in a year. Now, again, I'll go back to saying, hopefully this isn't because we're missing cases, which is likely. We probably are missing cases, but you do see the lowest numbers here. We continue to see our highest rates among men who have sex with men. And so prevention, education activities remain a high priority for all at-risk individuals, whether they're involved in our syringe services program or also men who have sex with men, making sure that education is out there, condoms are available, and efforts to ensure that PrEP is accessible to individuals who may be at risk. So let me shift to another infectious disease, hepatitis A. You may recall in 2019, there was a national outbreak of hepatitis A associated with IV drug use, general drug use, and unstable housing. And this was really a shift in some ways in hepatitis A, where which is historically thought of as a foodborne infection, where person-to-person spread became more prevalent in this outbreak. When you see the blue bars, those are cases related to the outbreak. The orange ones are suspected cases related to the outbreak. We had 38 confirmed cases and 11 suspected cases, which was our highest by far year with hepatitis A cases. But as of July of 21, it was for us considered to be the end of this outbreak. We haven't had any cases past those 3 incubation periods, but there still remain national outbreaks that we are concerned about for sure. We had an interesting outbreak related to the Firefly musical festival this year. So after Firefly, callers were calling into our epidemiologist, pointing us to complaints and conversations on various social media platforms. So we became aware that there were a number of individuals with severe gastroenteritis. And so our epidemiologists developed a case investigation questionnaire and distributed it to multiple states. 10 other states participated in this survey. Whole genome sequencing was performed. And so what this epicurve represents here is all of the cases associated with this outbreak. Now, only about 10 of them were Delaware cases. The rest were not Delaware cases. So it really does show you how interstate coordination is really critical in a situation like this. But there were 40 cases total, and just really showed how the person-to-person transmission takes place. Now, root cause was never fully identified, although one commonality was that many of the cases consumed food from one of several vendors who were kind of clustered in the same location. Another interesting salmonella situation was related to tiny pet turtles. We called it the tiny turtle outbreak. So between December of 2020 and September 2021, CDC investigated a multi-state outbreak of Salmonella typhimurium and Salmonella puna linked to these tiny turtles under 4 inches. 87 cases from 20 states and the District of Columbia became ill. 8 individuals were hospitalized, and there was a death reported in Pennsylvania. Now, there were no cases in Delaware, but we do have, we did identify sales of some of these turtles. So our team, was on their toes looking for these infections within our state. So while no cases were reported in Delaware, we were concerned about the sale and distribution. And it's important to mention that by state law, an exotic animal permit must be obtained from the Department of Agriculture before being able to purchase these cute little things. We also had some uncommon healthcare acquired infections this past year. So Candida auris confers resistance to antifungals and is an emerging public health threat. And this year it was detected in individuals transferred to Delaware long-term care facilities. Efforts to perform colonization testing in specific long-term care populations are crucial to prevention and control. And the resulting investigation highlighted the importance of communication across different healthcare entities. Also, Listeria monocytogenes. There was a multi-state cluster linked to pre-cooked Tyson chicken that was distributed to healthcare facilities. We had one case in Delaware, and there were two in Texas that were identified being by genome sequencing. So healthcare facilities in Delaware were notified, and surveillance was prioritized looking for other cases during this outbreak. We did not find any, but again, healthcare providers were on their toes looking for additional cases. Resistant carbapenem resistant organisms, also about resistance. Carbapenem resistant organisms are also of mounting health concern. Our most recent efforts to prevent the spread of a bacteria with rare genetic resistance was a huge success. However, it is important to stay vigilant and report them to us swiftly. So this is a reminder to make sure when these kinds of resistant organisms are identified that they do need to be reported to us. Like as was this recent case of E. coli with the rare New Delhi metallo-beta-lactamaser, NDM1. This NDM1 resistance was detected in a neonate due to vertical transmission, and this led to colonization testing of an entire NICU. Good infection control practices prevented the spread of this organism, and no other neonates were colonized. Another interesting case involved a NICU in Delaware, where over a 12-month period, 15 infants tested positive, 10 of which were colonized. 3, though, presented clinical symptoms. Bacillus cereus was also found on multiple environmental sources. Now, to date, no clear link has been found between environmental and clinical specimen. Therefore, multiple environmental sources are likely. But CDC got involved in this one again, and their recommendations, along with ours, included environmental cleaning, air filtration, daily replacement of pacifiers, laundry and isolate covers every 24 hours, and other environmental measures. Okay, this was a big one and a stressful one for sure. Some astute physicians from an orthopedic surgery practice contacted us to let us know that there were several cases of spinal TB that were identified in individuals who had, oh shoot, I'm sorry, I just went to the wrong one. There were several cases of TB that occurred after individuals had spinal surgeries. And so they let us know that these individuals all received cadaver donors between March and April of 2021. And the number of cases from the outbreak alone tripled our TB cases for 2021. This was really a devastating situation in which there were 23 patients involved, one who is deceased, 22 living patients, or they all had received this bone allograft product. The living individuals then all received a 4-drug treatment regimen, but almost all of them presented with TB complications, including abscesses, osteomyelitis, discitis, and or pulmonary TB. So a really devastating situation that led to Delaware notifying and working with CDC and FDA in multiple states. So multiple states, individuals in multiple states received this bone allograft product. And although there were consequences, health consequences in other states, the early identification of this really led to a lot of product being pulled off the shelf, so not being placed into other individuals, but also the ability to treat those who did receive this allograft material. So let me go back to this slide. But this was another stressful one too, where we worked with CDC on a Legionella cluster. So again, a health facility contacted us about 2 Legionnaire cases that were not patients in a hospice facility, but volunteer workers in a hospice facility. There was also another case of Legionnaire's disease identified about a mile away in an assisted living facility. So our team became very concerned that in this geographic area, there may be something in the public water system that was impacting individuals. At the end of the day, it did turn out that those 2 situations were unrelated. And what was identified after multiple water samples and environmental swabs and remediation, it was water system, and a little bit about Legionella. It is often comes from aerosolized water systems, whether it's cooling towers, decorative fountains. In this situation, a decorative fountain and a drinking fountain were found to be positive. And so at the end of the day, those were just taken off of offline and no longer being utilized. But a number of remediation and control measures were initiated very quickly. And so again, very fortunate that it was just a very limited number of cases involved in this outbreak. Another tuberculosis situation I wanted to mention was this G10727 cluster that started in 2009. And interestingly, the cases in this cluster are largely white and younger, and predominantly, many of these cases had been missed. In fact, the index case had seen healthcare providers 22 times before the diagnosis of tuberculosis. So it's really important to stay on our toes and to make sure that we're thinking about tuberculosis and diagnosing it as soon as possible. In fact, in this year, recently, an astute diagnosis of an infant led to a household of 2 additional TB cases. So again, remember, think TB, consider TB for any patient with compatible signs, symptoms, cough, abnormal cavitary radiograph, fever, night sweats, weight loss, hemoptysis. Make sure you think TB, and make sure that you work with our team, especially if there is a positive diagnosis. Rabies is out there, and in the year of the pandemic, we saw less cases, which is interesting because I do think a lot of people were outside, but this year we've seen an increase in animal cases. Bats are at the top of the list, raccoons second. It feels like at least once a month, and sometimes more often, putting releases out there about an animal, a rabid animal, who has either attacked another animal or a human. And as you all may recall, we had a rabies death just a couple of years ago of a human in our state. So again, it's just really important to take any of these human interactions with an animal, human bites, scratches from an animal seriously, and make sure that people are getting treated, and whenever possible, identifying the situation with the animal. I am going to close by just talking about influenza, which is on the rise. So this is our curve, just looking at influenza-like illness, where you can see that we are seeing a significant increase in influenza-like illness, or ILI, in the state. And this next curve shows you by the numbers, the diagnosed cases in the last week was about 84 cases, way up from 22 the previous week. So it's here. Right now, it's mostly A, H3N2. The green is A that's not subtyped, so likely mostly all the A, H3N2, but it is here. And so it is really the time to make sure that we are doing all we can to get people vaccinated. I can't emphasize this enough. Our health care system, our hospitals are stretched beyond thin right now, and we have got to keep influenza out of our hospitals as best as possible. So we've got toolkits to use in the community, electronic information that can be sent through social media, graphics, FAQs, including in Spanish and Haitian Creole, which are populations, especially Haitian Creole, that tend to be poorly vaccinated. So please help us get the word out there. Please help ask the question of all your patients, get them vaccinated for influenza so we can hopefully have a mild-ish flu season. With that, I'm going to stop my sharing. And again, just want to thank everyone for participating today. And I'm going to hand it back to you, Kate.